At this point, we'll be getting into that conversation on the COVID-19 situation in Nigeria with Dr. Chikwe Ihekweazu, the Director General of the Nigerian Center for Disease Control. Good morning, Dr. Ihekweazu, and thank you for joining us.
Thanks for joining us.
Good morning, Ruben and your team.
Yes,
great to be on your show again.
Yes, good. We're also very glad to have you oblige us. Quickly, let's start from the particular to the general. And I would like to start with the situation in Kogi State. If you look at the COVID-19 league table, as I often call it, we have 35 states and the FCT reporting cases. And that it used to be previously 34 states and the FCT. But 2 days ago or so, NCDC reported that 2 cases had now been reported from Kogi State. But the Kogi State government is saying that that is not true. Both the health commissioner in Kogi State and the commissioner of information, they were all over the media yesterday saying that the NCDC is planning to import COVID-19 into Kogi State by all means. And then in Cross River, we have not had any reported cases. In Kogi, there's also an argument over the number of tests that have been conducted. At one point, NCDC said it was 1 test conducted. At another point, Kogi State said they conducted 111 tests and all reported negative. What exactly is the situation in Kogi and Cross River states?
So, Ruben, thank you very much. Firstly, the idea of this being a league table gives the impression that the more points you get, the better you're doing. Really, this is not the case. In my privileged position serving the country, I really have been in touch personally with so many people infected and affected by this virus and by this pandemic. I've been in touch with people that have lost loved ones, with people that have themselves ultimately passed away. This is a very tragic situation in our country. The people infected are real human beings. They are fathers, mothers, brothers and sisters to others. And so it's very important that behind the numbers that we share every night, for all of us as a country to remember that there are people behind these numbers. Right now, there are people in hospitals, there are people on respirators, there are people that have buried their very loved ones from this virus. So behind these numbers are real people. And, it is for these people to tell you what their experiences are. This is a global pandemic. So we have no reason at NCDC to want to do anything with the figures. Our purpose is to prevent, detect, and respond to infectious diseases. This is our mandate, and this is how we support the states across the country in doing this. And we try and do this every day of the week, 24/7. That is the purpose of our existence. There were 2 new cases in Kogi State, 2 residents of Kogi that were referred to the National Hospital. We didn't have any idea where the samples came from. They were sent to us from National Hospital. We reported them as usual. Standard practice was carried out. These individuals live in Kogi, and the information was passed on to Kogi State for them to carry out the normal public health work. So, we have 2 cases in Kogi confirmed. Unfortunately, we haven't done the number of tests we would have liked to do in every state in Nigeria. Most states actually are pushing to set up labs and molecular labs. Edo has 3 labs right now. I just spoke to the governor of Jigawa State this morning, pushing very hard for us to come and activate their lab. The same is going on. Ogun has just been done. Katsina is being done. So states are ramping up their molecular diagnostic capacity radically in order to be able to detect and respond. This is the reason for existence. We have no business with, this is not politics where numbers matter when they go up and down. This is what it is. We try and report it the best way we can every day, honestly, to Nigerians. They need to make out of the numbers what they wish. But our role is to continue offering every state that needs and wants our support, the support that we have from the Nigeria Center for Disease Control.
Dr. Ihekweazu, thank you. And thank you for also pointing out that there are actually people behind these numbers, something we do always have to remember. Now, as you rightfully said, Nigeria has just tested under about 50,000 people so far. And if I'm correct, the Presidential Task Force in their briefing coming up on Monday, or in your briefing coming up on Monday, are due to let us know what the next phase with regards to the lockdown is likely to entail. So, of course, we know that we've kept the lockdown phase as it is for the past 2 weeks coming up to. So what are we likely to see given the current trend of COVID-19 in Nigeria as it is today?
Yeah, thanks a lot. I think that's a very key question. You know, we've spent the last few weeks really encouraging Nigerians and various parts of our society, whether it's our industries and our civil society or churches, mosques, wherever, however people organize themselves, to start preparing. The steps that we will decide on this week, led by the Presidential Task Force, will really decide on how much further we will, quote unquote, ease the lockdown. So how much further can we afford to open up society without risking an exponential rise in cases? This is the very careful balance we're trying to find. How do we balance the need to stay alive and prevent transmission versus the need for people to have their livelihoods and therefore able to live day to day? It's not an easy balance. Now, the finding people supporting us through this process will make it easier. So we will assess, and we know that industries have been preparing over the last 2 weeks in this regard. We will assess how much those industries have prepared, and not just industries, how much religious societies, religious groups have prepared, how much of our mosques, churches, schools, aviation, marketplaces, how much have they prepared to open safely? Last night I was on a fascinating teleconference with the committee as part of NEC, governors in Nigeria. And, you know, they told us how proactive they have been in working with the people in the states to manage the opening carefully. You know, the governor of Anambra State went into great detail on how he has worked with the union that manages the Onitsha main market in terms of how to manage a safe reopening of the market in order to, yes, restart the market, but restart it safely. So we will assess how the rest of the country has done in this regard and make critical decisions on the next phase. Do we open aviation? Do we ease up interstate travel? These are not easy decisions. I'm, in a way, not happy that I'm not the one making the ultimate decision, but we will have to look at the data, look at the health data, which we will provide from NCDC. That's the data we release every night. We'll look at the trends. But that's not all Mr. President will look at. He will look at economic data. He will look at security data. He will look at different data streams coming into his desk, and on that basis, make a decision on how to move forward. But you know, I think everyone watches on TV every night how difficult that decision is for countries around the world. Some have eased the lockdown, had to go back or adjust it a little bit, or tweak it a bit. And we might need to be more specific in areas where we intensify our response. So it might be that in certain local governments, in certain states, there will be firmer measures than in others. So we might need to be more precise in our action rather than broad stroke actions that we've had to carry out in the beginning. So these are hard decisions that we made this week, but there's no doubt about it. We need to find that balance because our circumstances in Nigeria make it impossible for us to stay alive while shutting down everything. I think Mr. President realizes that very well and has had to kind of carefully navigate this very difficult decision-making space. And our role is to support him as best we can, making sure that he has all the data presented to him in an honest way about the circumstances, both from the public health, the economic, the security, and all other influences that will lead him to make the best decision for our country.
Well, Dr. Ihekweazu, we have less than 2 minutes to go. Quickly, let me ask you, you've been quoted in the papers today saying that rapid testing kits are now being sold in a growing black market. Now, has there been any investigation? who is responsible for the sale of these rapid testing tech kits, and how much of a threat does that pose to your work and to the public?
So, thanks, Ruben. I'd like to say that in the long term, even in the medium term, there will be no better development for the work that we do than having a rapid diagnostic kit. And actually, the Medical Laboratory Science Council of Nigeria is going to make a pronouncement around the number of kits that they have been evaluating. The Nigerian Institute for Medical Research, too, has been evaluating some kits. So eventually, we will love to have a rapid diagnostic kit. But the critical thing for RDTs is that they need to work. We need to know that they work. If they don't work, then they're a distraction and a disservice to people, because it is incredibly terrible for the response. If you test someone and you don't know if the positive result means a positive, i.e. he has the infection, and the negative needs a negative. And unfortunately, in our desire for quick results, many organizations, many hospitals, in fact, many parts of our society are reaching out for this apparently easier solution. I want to just make it clear to Nigerians that there is no rapid diagnostic kit test that works sufficiently for us to make a clinical diagnosis on whether you have the disease or not. But this is, we live in the country that we do live in. My role is to advise both individuals and organizations and hospitals that there's no RDT kit at the moment that meets the standards required to make this diagnosis in Nigeria. So anyone relying on it to make clinical judgments is putting himself and his patients at risk. And it's very important that this message is very clear. It's not the role of NCDC to regulate kits and manufacture and sale, but our role is to advise the public clinicians and decision makers on what kits can allow you to make this critical judgment for your patient.
Thank you very much.
Thank you very much, Dr. Ihekweazu.
Thank you very much, Dr. Ihekweazu.